This presentation is on using objective risk analysis to determine the risks associated with a study subject's sleep loss. The presentation will use probabilities to determine which risks should be focused on to alleviate the subject's sleep loss. For the risk assessment of sleep loss, we will use an objective risk analysis, as opposed to a comprehensive risk analysis, which uses subjective expert opinions. Objective risk analysis is more accurate than other methods because it uses a quantitative approach as opposed to a qualitative, subjective approach with opinions, which could be biased. Also, objective risk analysis is faster than a comprehensive approach. A comprehensive approach requires interviewing experts and interpreting their opinions, which is time-consuming. Objective risk analysis does not require expert interviews and instead only needs probability of occurrences and sometimes cost of occurrences. Thus, objective risk analysis has the advantages of objectivity, accuracy, and speed. Here is a chart of the incidences of the subject's sleep loss. The left column shows the date of the incident, and the right column indicates the cause of the occurrence. Shown here, we have categorized the incidences into 3 areas for causes for sleep loss: stress, social life, and environment. The final row of the table shows the counts of each of the categories. Highlighted in yellow, the subject lost sleep due to stress 4 times, social life 2 times, and the environment 4 times. The daily probabilities for each category of occurrence were calculated by finding the average time between each occurrence within the category, and then dividing 1 by this number. The results are the 3 daily probabilities highlighted in the final row of this table. So, the daily probability of the subject losing sleep because of stress is 0.052, or about 5 in 100. The daily probability of the subject losing sleep because of a social life is 0.043, or about 4 in 100, and the daily probability of the subject losing sleep because of the environment is 0.074, or about 7 in 100. The higher the daily probability of occurrence for a type of risk, the higher the priority for intervention to try to reduce sleep loss for the subject. Therefore, for our subject, their environment had the highest daily probability and therefore is the highest priority. Stress was the second most common cause and thereby is the second priority. Finally, the cause of social life had the lowest daily probability and is therefore the lowest priority. Our analysis indicates that the subject should take action to minimize the effects of the environment on her sleep loss, first and foremost. Perhaps the subject should try earplugs, but that is beyond the scope of this analysis. Overall, using the objective method of probabilistic risk analysis enables us to consider the risks without the subjective bias that could occur in a comprehensive analysis with experts. This quantifiable analysis allows us to prioritize the risks based on probabilities. By having these priorities and focusing on them, we can maximize our time by concentrating our efforts on the areas that show the highest probability of risk. In all, I hope this presentation illustrated the utility of using an objective risk analysis.